My project is on macular degeneration. Macular degeneration, or MD, is the deterioration of the central part of the retina called the macula, which is the inside layer of the eye. You can see in the photo to the right. The macula records images we see and transmits them to the brain from the optic nerve. The macula is responsible for focusing central vision, so people with MD will not see images in fine detail. This makes reading, driving, recognizing faces, objects, and colors difficult. MD is the leading cause of vision loss in the U.S., more than glaucoma and cataracts combined. It is incurable. So these are just some disease stages. The early stage, your vision is not really affected much. You do have the start of drusen buildup, which is yellow deposits beneath the retina, and they're about medium size in early stages. And as the disease progresses, you have more wavy, blurred vision, and your central vision can be completely lost in the stage. So as the disease progresses, the drusen just grow larger. And in advanced stage, you're considered legally blind. The rest of the retina is still working, so you can still see using their peripheral vision, but it's not as clear. And you can see in the photo to the right, that's kind of how it looks. So these are some types of macular degeneration and their physiology. The wet or exudative type is 10 to 15% of cases. And this case, vision loss is rapid and severe. It's characterized by cortical neovascularization, which is abnormal blood vessels that grow under the retina and the macula. These blood vessels leak fluid, causing the macula to displace from its normal position. Central vision distortion results, and patients may see dark spots in the center of their vision from blood or fluid leakage. So you can see that in the photo on the right. And then you have the dry or atrophic type, and it is 85 to 90% of cases, so the majority of people have this type. Less severe vision loss and better central vision than the wet type. No leakage of fluids. Drusen buildup causes the macula to thin over time, and some patients with the dry type will actually develop wet type over time. And then the dry type, patients may experience blurred central vision and blank spots. You can see in the photo to the right, and that is from the parts of the macula starting to die. The epidemiology. MD is the leading cause of vision loss in Americans 60 years of age and up. Up to 11 million people in the U.S. have some form of MD, and that's expected to double by 2050. Age is a prominent risk factor for MD, so as age increases, risk increases. The etiology. The exact cause of MD is unknown due to lack of research. What we do know is that it is a complex disease, and it involves hereditary and environmental factors. More research is needed to understand what causes the macular cells to deteriorate. Patients with a family history of MD are at a higher risk for developing it. Medical management and pharmacologic considerations. So there is no known cure for MD. However, you can reduce your risk and possibly slow the progression by doing things like dieting, exercising, not smoking, and using UV light protection for your eyes. Physicians have used antioxidant vitamins and zinc in high doses as injections to slow progression to the advanced stage. Some examples of this, bear with me: Beovu, Eylea, Lucentis, and Macugen. I don't know if I said any of those right, but you can see in the picture to the right, that's an example of a vial that they would use to give an injection. Dental considerations. According to the Dental College of Georgia, there is a link between chronic perio and macular degeneration. PG can invade epithelial tissue, fibroblast, and dendritic cells. Human retinal pigment epithelial cells, which is part of the eye, were infected with PG. This caused a significant increase in expression of gene levels that were important in immunosuppression. So this study kind of demonstrated a link between oral infection and MD pathogenesis. When PG invades human retinal pigment epithelial cells, it can elevate MD-related genes that might target molecules for both chronic periodontitis and MD, so they kind of play a part in each disease. These are some general modifications to consider as a dental hygienist. Patients with visual impairments can have poor oral health due to physical, social, and emotional barriers, such as the loss of the ability to drive themselves to appointments, difficulty using the telephone, trouble managing money, inability to maintain their own medication regimen, depression, and anxiety. Many patients with MD rely on family members or caregivers, so educating the caregivers about the importance of maintaining optimal oral health is very important. These are some in-office modifications. If the patient is not with the caregiver, any forms needed should be available in large, bold text. Offer to assist the patient in reading and filling out forms. Make sure the lighting is efficient and there is nothing in the walkways the patient could trip over. The patient may not need assistance walking, but you should supervise and provide guidance in areas that may warrant caution. For example, a carpet that is flipped up, or a step up, a ledge, an electrical wire. Just kind of vocalize those areas of different terrain to them to prevent them from tripping and falling. If the patient is with the caregiver, include the caregiver in the patient's treatment and make sure they understand their OHI instructions in case help is needed at home. These are OHI modifications, so you should modify the OHI based on the level of vision impairment. Talk to the patient, learn about the extent of their eyesight before you teach them. MD patients can see blurred lines or shapes in their peripherals, so the show, tell, do teaching method is still applicable in some situations, depending on what stage of disease they're in. So if they're in a more advanced stage where their vision is more blurred and their central vision is completely gone, you might need to use feelings or other senses to describe. So for example, the modified Bass technique, tell them you can feel the brushes or the bristles going up into the gums. But the most important modification, I think, is the use of a bright colored toothbrush and a toothpaste with a flip cap. Flip caps won't get lost like the small screw-off caps we normally use with regular tubes of toothpaste, and the neon toothbrush is way easier for them to see. I think adding a black suction cup to the mirror to hold the toothbrush, the black background could help the neon pop, and since it is suction to the mirror, it's like a permanent home for the toothbrush to live, so the patient always knows where it is. Another thing I saw a person with MD do on the YouTube was he placed the toothpaste directly on his tongue, just kind of licked the tip of it instead of squirting it on the brush head directly, because it's kind of hard for him to see and he missed and he would get all over the counter. So as long as it's your personal tube of toothpaste, I think that for sanitary reasons, that is okay. And of course, you want to include the caregiver in OHI, like I said. Make sure they know the regimen in case aid is needed, because patients with MD a lot suffer from depression, and we know with depression and anxiety there is a lack of motivation, so the caregivers will really have to step in at this point and make sure the patients are doing what they need for their oral health. The OT student I talked to expanded on kind of what I said in this, and they said the main thing they can do is just rely on other senses to make up for what kind of vision impairment they have. So like I said, feeling, touch, smell, things like that. So this is my interview or personal experience. This is my grandmother. We call her Mimi. She lives in New Orleans. She recently lost her husband in December of 2019. My aunts and my cousin live behind her in an apartment. So they live right next door and they're her caregivers. She is, I would say, an advanced stage of macular degeneration. She says she can see blurred outlines of people, but she recognizes us by the sound of our voice and maybe our hair colors and things like that. As for her getting around, she doesn't drive. She's lived in the same house for over 60 years, so she can navigate it pretty easily because she knows where things are. She doesn't really go to the grocery store by herself. But the main thing is some lifestyle considerations for her. Since she recently lost her husband, she has been dealing with some motivation issues. She's a little depressed and anxious, so her oral health is not of the top priority to her. That is why it is important for us as her caregivers to kind of step in and make sure she is keeping up with her oral health. She's also been a smoker since a young age, so this plays a huge role in the progression and the state of her disease. She's also having help from an organization called the Lighthouse of the Blind, and they're bringing her this big magnifying glass, I think is what you call it, and it's going to help her read her recipes she's written, and because she basically can't read, so that's going to help her kind of increase her quality of life a little bit if she can use that magnifying glass to read and cook, and they help her do things around the house. So hopefully with help from her caregivers and organizations like that, she will have her quality of life improve, and her motivation will also improve with it. These are my questions. And these are my references.